Okay, good afternoon, good morning, good evening, uh, good wherever it is you are joining us from. Good morning, good afternoon, good evening. This is Living LTV live with me, Gbenga Adebayo, and today we're taking a look at one interesting topic. If you're a woman and you live long enough, hopefully by the grace of God, you live long enough, you would experience this phenomenon, and that is menopause. We're going to be talking today about all you need to know about menopause. So, if you are a man and you have significant, you have women in your life, this is also an important thing for you to know because it's an interesting topic because often around the time of menopause, it becomes a mysterious thing to many people, and they might get the wrong takeaways and believe the wrong things about what menopause is, what is not, and that's why when the team met earlier a few days ago, just said, "Oh, let's discuss menopause." I said, okay, let's go ahead. Let's discuss it. And the person that suggested that we should take a look at this was one of the female members of the team. Okay, so we want to take a look at menopause. What is it? How does it affect one? Must everyone go to menopause? What are the? Can we delay it? Can we postpone it? Can we cancel it? So what exactly it is. So thank you so much for joining us. If this is your very first time of joining us on the show, it's a pleasure to have you. I'd like to encourage you, please like this video, share it with your friends, and if you have any question, please, you know what to do. At any time during the course of the broadcast, you can just go right ahead and and drop the question in the comment box, in the chat box, and we'll be happy to answer. If you have not subscribed to Living LTV, what you gain? I beg, hit that subscribe button and make sure that you hit the bell notification so that every time we are we are up, you'll be one of the very first to see our content and to be an encouragement to us. Likewise, for you to be subscribed, to be a subscriber. So now, so what is menopause? What exactly is it? How does it happen? Must it happen? Well, every woman from when a child, a baby girl is conceived in the womb, there's finite number. The number of eggs that she will have all through her life is fixed, right? It's fixed from when she is in the womb. She has the number of eggs, an embryo, very tiny. The number of eggs that she will have through her reproductive life cycle is fixed. And then every month or every menstrual cycle, so to speak, she starts to release one every cycle. Some maybe two in some cycles, but she starts to um, release those eggs. And then a time will come, if something is fixed, something has a definite number, it's going to finish, right? So the eggs finish, the hormonal cycle of that woman finishes, and then she stops producing eggs. So she stops menstruating, and then it's all done and dusted, and she cannot have babies anymore. So a woman starts to release eggs, starts her menstrual cycle at menarche. That's the first time a little girl is going to have is going to menstruate, and then she continues until we reach that place when she stops. That place when she stops seeing her menstrual cycle, stops shedding blood every month, stop um, menstruating, so to speak, is what we call menopause, cessation of menstruation. Although I see that there is pause, that pause there is stop actually. I don't know why they call it menopause. It should be menostop, but for all intents and purposes, we call it stop because actually, truly, even after menopause, a woman um, can still be induced. Her body can still be made to carry a baby, right? So So let's leave that. That's not what we are discussing today. We are discussing about menopause, which is what happens to almost all women. Trust me, if you live long enough, you will enter into menopause. So, like we said, it's you have a finite number, you have the predetermined number of eggs by the time you are born. The eggs in the ovaries of a lady, of a baby girl, are fixed. It just makes sense that if you start your um, your cycle early, it's possible that you may finish earlier. Okay, so that also suggests to us that menopause is not fixed. So because it depends on so a number of factors, but most women will enter into menopause between 45 to 55 years of age. That's a very wide, and some people may even enter way earlier. We see some people for several reasons they may start to they may stop menstruating even way earlier than 45. We say a woman has entered into menopause if for 12 consecutive months she doesn't see her menses, right? For 12 months, she just so it's bye bye to to menstruation. So that's what it is. Why does it happen? Why does it happen? Like I said, it's because the number of eggs in that woman finishes, and of course the hormonal factors responsible for for these changes, these monthly cyclical changes in a woman, are due to two key hormones, estrogen and progesterone. So these hormones also they fall off and they stop. So the woman stops experiencing, because that's what causes the uterus, the womb, to respond the way it is. Estrogen comes, progesterone comes, it cuts off, pull, and then the woman sheds the lining of our uterus. Beautiful, an interesting phenomenon, because that's about the only part of the body that repeatedly gets injured and yet heals without scarring. There is no scar, absolutely no scar in the womb as a result of menstruation. Because like a wound bleed, and then the person bleeds, and so those hormones, when they go away, the woman starts to experience all the changes that happens uh, with menopause. So it's as a result of normal body mechanisms that wane with age. Woman stops producing eggs, stop producing these hormones, and then of course stop menstruating. The age range is between 45 to 55. But can it come earlier? Are there things that can happen that can make somebody to experience menopause earlier? Certainly. So anything that will tamper with that hormonal circuit in the body can cause menopause. So if for whatever reason, for medical reasons, the ovaries, which are the organs that produce these hormones, if we remove the ovaries of a woman, or they get removed, they get damaged, that woman can have an early onset menopause. So what if they remove the womb? Can we say menopause has started? No. Once your ovaries are still there and they are working, they will still continue to produce these hormones, whether there is an uterus or not. So if it's all that is removed is just the uterus, the woman cannot be said to have entered into menopause. Even though she may not be bleeding, she will not be said to have, medically speaking, to have entered menopause. I just like to quickly say that there are some people that their menses are not regular, right? They may bleed, have their menstrual cycle once in 3 months, once in 6 months. So those people may have an hormonal imbalance. I know someone that she was really happy, right? She was not married, and she was happy that she was not menstruating. That she just felt it was an inconvenience. How can I be menstruating? Thank God I'm not menstruating. She wasn't menstruating every month. She didn't tell her spouse. They got married, and then went into first month, third month, it's not getting pregnant. I was now wondering, why is there no baby? Why is there no baby? And now told the person, I've not been menstruating. The guy was livid, right? Because if you don't menstruate, you can't get. She didn't know there was anything wrong. She just thought it was a blessing that she wasn't bleeding every month, right? So if you are not on oral contraception, or you are not on any contraception, right? Because there are contraceptive methods that will stop a woman from menstruating. Because some people even say that menstruation in this age and with the knowledge that we have is a thing of choice for a lot of women, because we know what causes people to menstruate. So if we do some things, especially for contraception purposes, hormonal contraceptives can make a woman not to menstruate anymore. So if you are not on any contraception and you are not menstruating regularly, you need to see your caregiver, you need to see your provider. If you want to have a child, you hope to have children. If you don't want to have a child, it just shows that something is not going on the way it is. It's best that we find out what that is and take care of it, right? It's teaching time, they say, saves nine. So please, regular menstrual flow, regular menstruation cycle is something that all women should experience. And if you are not experiencing that, then please, by all means, go see your physician, go see your doctor. Let's know what is the matter and take care of it. It can be taken care of. So that is some background about menstruation and menstrual cycle, and of course, as it relates to menopause. So, what are the signs and symptoms of menopause? How does somebody know that, oh, menopause is here and knocking at my door? So, before that, as I said earlier, that we say somebody has entered menopause if for 12 months, right, a whole year, a whole calendar year, they have not experienced any menstrual bleeding. Then we just, okay, menopause has started. But before that full cessation comes, there will be something we call the pre-climacteric period, right? Around that period, your period may not be as regular as it should be. It may come, go, come today, not come as maybe lighter than it should be. Not maybe you're used to seeing for 3-4 days, may just come, spot one day and goes away. So those are some of the things you see around this climacteric period. And then the symptoms are there, and the symptoms that are distressing for many people is the hot flushes or the hot flashes. Depends on what you want to call it. And that's the feeling of heat, sweatiness, right? Uncomfortable, just be uncomfortable, feeling off, flushing skin, and just feeling that something is and then of course this can come with cardiovascular symptoms. You can have a lot of dryness in the vagina, loss of interest, and this may be maybe a source of friction with people that are partners, right? The partner may be wondering, why are you not so much into you? Are you not into me anymore? You are always complaining. You have this, you are feeling hot, you are feeling cold, and then it becomes painful to have intercourse. So a lot of understanding of what is happening is important, right? So that's why I hope there are some men on this call. When a man watches this after now. So if your wife is around this age, 45 to 55, and then she starts to say she's hot now, she's cold, her blood pressure, because cardiovascular symptoms become common around this time. So your blood pressure is not stable, it's going up, it's going down. Some people may even have things that look like panic attacks, right? It's your heart is beating, just to have palpitations, your heart just to pop, 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 pop. So this can all be tied back. They can be related to this menopausal symptoms. So it's important this is approach with understanding, right? Is there help? Yes, there is help for people that are experiencing menopause. First, a good understanding that this is what is happening to me, right? This is my body is going through these changes, and then of course there is the plan to take hormone replacement therapy. Now that you the that no, we say what causes menopause is what your body starts producing some key hormones. and the cessation of those hormones is one of the things that give rise to all these symptoms that you have, right? The hot flushes, the cardiovascular symptoms. After a while now, people still also have bone vitamin D deficiency, bone resorption. The bone becomes weaker than it is, so that you can be more prone to fractures if you are not careful, and then just general weakness and the like. So if we can replace those hormones and get them back, then it stands to reason that these symptoms of menopause may just go out of the windows. But however, there's nothing. Well, this therapy is not without is a side effect. So it's now weighing the risks benefit ratio. If your symptoms are not so disconcerting and you can cope with them, you can live with them, it may be better to forego HRT, right? But if we now look at it that the symptoms, because HRT can lead to a whole gamut of complications that you would need to be aware of, and your physician, if he's going to place you on HRT, we discuss HRT is hormone replacement therapy. We discussed this possible complications with you before you go ahead and start to use this hormone replacement therapy. So we weigh it. We weigh the benefits. We say, is this worth it? And if that is, then we can now do the other things, right? So that's that the spectrum. I've gone to the end. So let me now go back to the beginning. So the other thing that we can do is just to get symptomatic relief, right? Symptomatic relief. We just try to treat the symptoms, because guess what? After a while, all these symptoms will clear up, and the person will be stronger, happier, and the better for it. So let's start to talk about the symptoms, the mental symptoms first to speak, the feeling. So a place of getting support is important, because changes are going through your body. You're wondering, what's up with me? Why am I getting this moody? Why am I getting this emotional? What's this? Understanding, right? Your body is going through some changes and you can overcome them, right? So as you sleep, hot flushes, please don't sleep with with thick garments, right? Just sleep light, sleep with breathable garments, right? Linen, cotton, things that can help you to get properly aerated. If you can afford to put air conditioning in your room to get you to just keep your body temperature and keep cool and comfortable, that is all good and dandy. It's also be nice for to work with your physician, like you said, calcium, you start to get osteoporosis, right? The bones start to become thinner. So supplementation at this time may be important, vitamin D, calcium, but discuss this with your physician before you go on long term. There are a lot of 419 people, like they say for area, a lot of people just all kind of people, all kinds of supplements, people selling all kinds of stuff. And we need to be careful about all these supplements. These supplements can cause trouble. You can they can be even water, right? If you take too much of water, you bedwet, you urinate. So there can be too much of a good thing. So we encourage, we advise that you please, before you go on any long-term supplementation, please discuss with your physician. The only people that I encourage without reservation to say, please take your medication and take your supplement. Of course, are pregnant women, right? So we ask our pregnant women to please take folic acid early, in fact, early in the pregnancy, because that's when it's most useful. It's not as quite as useful for you to start to take your folic acid when you're in your second, third trimester. We need it early. That's when we want to prevent all the neurodevelopmental congenital abnormalities that we don't want that. We don't want neural tube defect. So folic acid, very, very important supplementation for people in our environment. Iron supplementation is really important, right? Because a lot of people go into pregnancy with anemia, iron deficiency anemia. Their blood level is essentially low right before they enter pregnancy, and then pregnancy is a high demand state. They bleed. That's one of the reasons why our people, sad. No woman should die because she's fulfilling our desire to have a baby, to bring a life into this world. So our pregnant women should use, and it doesn't have to be expensive. There are a lot of expensive things that people pack together. What you need is folic acid and iron, iron, elemental iron. And then if you want to afford it, any other stuff. And then, of course, with time in your pregnancy, your doctor will tell you when you need to take anti-malaria medication, at least in the tropics, in this environment, right? So that's what so for the pregnant, for the menopausal woman, right? So please discuss with your physician what to do about um, about supplementation, right? For calcium and vitamin D supplementation. It's also now important for you're in your many perimenopausal period. Your blood pressure, right? Your blood pressure. Please keep it in check. If you have been diagnosed before to be hypertensive, use your medicines. Use your medicines. Somebody look at you, doc, I don't say use your medicine. Do you use medicine? Is it easy to be using medicine every day? Believe you me, I know it's difficult. I understand it's tough to be, but it's for you. It's for your greater good. It's better to use your meds and be alive than not to use them and be dead, or worse off, be a living dead. Have a stroke. Stroke is terrible. Stroke is deadly. Stroke debilitating. Right. So use your meds. And don't just use anything. Don't say they are doing this, they are doing that. They say if you use this, you use this. Some people, I've seen somebody say your menses stopped, and then she went to one traditional um, fella that said he's going to call the menses, and then they put something in their hand, and then they swept our womb and did all kinds of stuff to our womb, and then guess what? She had our womb collapsed and healed together. You know, I said menstrual cycle happens and the person's womb does not scar. They did something. They put all kinds of corrosive. This one was even someone that had menstrual disorder and trying to have baby, and then they just destroyed her womb, right? They destroyed her womb. It was what we call wound ablation. They just finished the finished the inside of the womb, and the thing became glued together. So please be careful. Say going to all kinds of. And then for, I'm sure men would like to hear this, be understanding, like I said to the men. So the sex drive of a woman in a perimenopausal period may not be as high as you would. Not certainly. The woman is uncomfortable, her vagina is dry, she has dryness. And when there's dryness in the vagina, there's pain, it's painful to have intercourse. So that certainly is not something. So what you can do is to show some understanding, and please use lubrication, right? Use lubrication. So if you're going to be having, as a man, get a lubricant. Be patient, right? Uh, it's a myth that it's not true that menopause means that the sexual lifestyle of the sexual intimacy life of a woman is over. No, it's not true. It's totally not true. In fact, some women tend to now become to enjoy intercourse better after, because they are no longer afraid of a baby. They're no longer contraception of it. They are not afraid. They are not worried. Wisdom has come. They are now older. They understand their wants. They understand their needs better. And if given opportunity, they're able to express it, that this is what I like. This is what I want. So, dear ladies and gentlemen, menopause does not mean that the end of the intimate life of a woman, that the woman is all finished. No. In fact, some people do now tend to be more, their appetite gets better, their enjoyment gets better after menopause. But great man, lubricant. Get a water-based lubricant, not Vaseline. Vaseline is not the right lubricant to use for water-based liquid, and they are all over the place, right? You can get them. They're not expensive. They're cheap, right? You can get them, and they even come now in disposable sachets, right? Small, small. I saw some recently, just small chat sachets, and then that you can use and get it disposed. So, and whatever it is, discuss with your physician, right? So, menopause is not something that means the end of the world is all over, is finished, right? No, 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 no. We can face it, overcome it, and live a happy life. So I've covered a lot of stuff. Somebody mentioned, I said, what of menopause for men? I said, okay, menopause for men. We will discuss that. Can men go through menopause? Does menopause happen truly for men? Right? Right? We'll discuss that by the grace of God next week, Friday. So if we have any question, I'll pause and wait if there are questions so that we can answer those questions. Are there questions? Do you understand what we've said? Does it make sense? What do you think? Questions. Are there questions? So menopause is the discussion. We've gone through what it is, why it happens, when does it happen, how does it happen, and then spoken a few things about what you can do with it when it does happen. If you live long enough, you will have menopause, right? If you're a woman, you live long enough, menopause will happen. So it's to face it and to deal with it as appropriate, right? Okay. In the absence of any question, we'll end this um, episode of Living LTB Live. So thank you so much for joining us. See you again next week, Friday. Stay healthy. And like area they say, remember I say, life, you don't get duplicate. God bless you.